Fox 24 is committed to helping you along your journey to wellness and an exploration into alternative treatments to common ailments. We'd like to welcome back Dr. J.P. Saleeby, Medical Director of Carolina Holistic Medicine, who's back this month to talk about a common disease here in the Low Country, and we're talking about Lyme disease.
Right.
So how common is it?
Well, it's much more common than people think. The British Medical Journal published about a month ago a report of a sampling of Eastern Europe and Asia, and they correlate it with a worldwide incidence of about 14.5%. So almost 15% of the world's population are testing positive for Lyme disease.
And how do you get Lyme disease?
Well, traditionally people think of the tick, and they think of northeastern United States like Lyme, Connecticut, which it was named after. But the tick, the soft and the hard tick, as well as the mosquito and the flea, can transmit it.
Oh, because I'm always thinking ticks. I had no idea that it could be transmitted by mosquitoes as well.
Yes, and through the placenta. So it can be, you can get congenital Lyme. If a pregnant mother has it, she can pass it through to her baby.
What are typical symptoms? How do you know if you have it?
Well, it's all over the place. So acutely, the acute infection is usually headache, kind of like that summer flu, body aches, malaise, chills. Some people get a encephalopathy if it's really bad. But the chronic is a different animal. It's totally different. It can happen and present itself 3 or 4 months later after the acute phase, or years later, like 20 years. And that can be anything from arthritis to heart issues to other organ issues, neurological, psychiatric. It's all over the place.
How do you diagnose it?
Well, it can be a clinical diagnosis. So with a good history and something we use in our office called the Horowitz questionnaire and some basic biomarkers like a CD57 and a C4A, we can make a good guess at what the diagnosis is. But if you want a confirmatory, LabCorp and Quest don't really offer the type of testing that's going to
So blood tests don't show it?
Well, not from them. So
okay.
The serology or the blood test, you have to use specialty labs like IGeneX or Vibrant Wellness. And they're more elaborate. They use different kinds of technology like PCR and FISH, and that can help you make a diagnosis. But sometimes even then that falls short.
How does it usually get treated?
Well, treated in the acute phase, doxycycline or Ceftin, usually for anywhere from 28 to 60 days to completely annihilate the organism. Borrelia burgdorferi is the organism. But with chronic, it's a totally different game. You have to use antibiotics, or you can use herbals, but you have to do a protracted dose.
Let's go back for a second. You mentioned chronic. So how does the condition turn into a chronic one?
So if you don't treat the acute in that little window you have of about 2 weeks, it can go on to chronic.
And you can never get it out of your system,
well,
or you can only mitigate some of the symptoms?
Exactly. So with acute, if you treat it aggressively enough and in time, you can completely kill off those organisms. But if you miss that opportunity, they sort of embed and they hide. They hide in little forms like cystic forms, and they're very hard to get rid of, and you have persister cells. So then you can't really say you're cured of it. You have it in remission, or you're right, like you say, you can mitigate your symptoms. But you cannot ever really totally obliterate those little guys.
Wow. And so antibiotics traditionally is how one would get rid of them. But take penicillin, for instance. A lot of people are allergic to penicillin and can't use that as a treatment option. But the holistic options that you were mentioning, that's something that most people can take advantage of?
Yeah, less collateral damage. So you can use doxycycline, you can use macrolides like azithromycin, Ceftin, which is a type of penicillin related with fewer allergic reactions. But if you look at herbals, there's things like cat's claw and banderol and inula. These are products that are used.
I actually have a few down here as well.
Sure.
B1, vitamin C?
Well, vitamin C helps your immune system.
Okay. Fish oil?
That also helps as an anti-inflammatory.
Garlic?
Yeah, so aged garlic can help. There are some that are used by naturopathic doctors and herbalists, but there are some that are directed. There's a newer one that has a lot of noise on the internet. It's called Cryptolepis. That seems to have a broad coverage of both the Lyme and their co-infections.
Interesting. And you make tinctures. to help treat this.
Right.
And what's a tincture?
A tincture is an extraction, alcohol or vinegar extractions of herbals. And so that you're not having to boil and make your own herbal. They come in both, usually liquids. They're easier to handle.
And this is to treat both the chronic and the acute?
Yes, you can use them for both,
Okay.
but we typically use the herbals with chronic since it's a protracted. We're talking months, 3-6 months a year.
Wow.
Yeah.
Oh goodness. So it's really a commitment.
Right, it is.
Yeah.
You have to be all in.
You're better off though in the end.
Oh, yes.
But of course, for anybody, they should always check with their primary care physician.
Right.
Make sure that that's a proper course of treatment. Thank you so much.
Sure.
So fascinating. Good to see you again.
Okay, good to see you.
Appreciate it.
Thank you.
We're back after this.